Hello and welcome to my channel. My name is Fadria Muhammad. Today we will see about the hormonal regulation of female reproductive system. In this session we will see about the 2 points. The first one is what are the hormones included under the female reproductive system, and the second one is the hormonal regulation. Due to hormonal regulation, what will happen in the female reproductive system, which is the menstrual cycle. Till the end, stay with me. Bye. Here are objectives. We do have around 2 objectives. The first is what are the hormones of female reproductive system, and the rest objective will be covered by this session is the physiological process and changes during menstrual cycle. So let's see one by one. When you come to the female reproductive hormone, let's see first hormone. What a hormone is, especially in the reproductive system. What are hormones, especially in the reproductive system of the woman? So the hormone is a signaling chemical which can circulate in our blood, and it signal, or it produces signal, especially in the woman during time period of childbirth, reproduction, either in ovulation or menstrual cycle. So different hormones control or regulate the activity of different cells or organs. It depends. The function of sex hormone differs from the other system hormones. So in case of sex hormone or female reproductive hormones, how it can regulate the menstrual cycle or the ovulation, we will see, including in the cycle of reproduction and the reproductive age of women throughout their life. So the functions of 5 main hormones that regulate the female reproductive system were around 5 hormones. These are gonadotropin releasing hormone, follicular stimulating hormone, luteinizing hormone, estrogen, and progesterone. We will see detail about these 5 hormones in the function or the physiology of female reproductive system. So when we come to the gonadotropin releasing hormone, as we all know, is part of the brain called the hypothalamus, produces this type of hormone, and when it circulates in our blood, it causes the release of 2 important hormones we have listed previously, which are the the luteinizing hormone and the follicle stimulating hormone. So due to presence of this gonadotropin hormone, the additional 2 hormones will be produced. In case if someone has to be functional luteinizing hormone in whatever the characteristics, the first issue is the gonadotropin releasing hormone must present in the circulation of the blood. The rest, let's see, follicle stimulating hormone. As we have seen previously, it's produced by the pituitary gland during the first half of the menstrual cycle, which means the first 14 days. It stimulates the development of maturing ovarian follicle and the ovum production in the female, as well as it has also function on male reproductive system or male reproduction as sperm production. So follicle stimulating hormone present in both male and female. The third type of hormone, or the second type of hormone which can be produced from gonadotropin releasing hormone is the luteinizing hormone. Is also produced by the pituitary gland in the brain, and it stimulates the ovary to produce estrogen and progesterone. You see, the relationship is interrelated. The first issue, as we have seen previously, is to have functioning luteinizing and follicular stimulating hormone. A person must have gonadotropin releasing hormone, or functioning brain and functioning pituitary gland. So if there is functioning pituitary gland, which means there is no disease or there is no pathological condition in the brain pituitary gland part of the an individual, the woman or the person had functional gonadotropin hormone, and thus the gonadotropin releasing hormone presence enhances the presence of or secretion of luteinizing and follicular stimulating hormone. In turn, if an individual has a luteinizing hormone in the circulation, or is functional luteinizing hormone which acts on the ovaries, which produce or which makes the ovaries to produce the rest two hormones of female reproductive system. These are the estrogen and the progesterone. So the other function of luteinizing hormone is it triggers the ovulation, which means the release of mature ovum from the ovary. We will see in turn detail about the ovulation and menstrual cycle in the next sessions and the slides. So the third advantage of luteinizing hormone is it promotes the development of the corpus luteum, which means the empty shell of an ovum after ovulation, which means if luteinizing hormone promotes the development of corpus luteum, means corpus luteum in turn for the next 14 days of the menstrual cycle, it produces progesterone. So in other words, luteinizing hormone presence enhances or promotes the secretion of progesterone hormone. The rest, the fourth hormone in this session is the estrogen. It's, as we all know, it's a female reproductive hormone produced primarily by the ovaries in non-pregnant women. If the woman is in non-pregnant stage, the estrogen, or the only source for the estrogen, is ovaries. And its advantage, or what it makes in the woman reproductive system, is it promotes the maturation and the release of an ovum in every menstrual cycle. So if there is functioning estrogen, functioning means in terms of maybe number, in terms of amount, because especially for a non-pregnant woman to function or to have normal amount of estrogen in the circulation, she must have functional ovaries. So if she have functional ovary, she may or she will have enough number of or enough circulating estrogen in the blood. So the presence of estrogen promotes the maturation and the release of an ovum in the every menstrual cycle. If the ovum matured, or if the ovum maturation or release of the ovum occur, there must have what? The ovulation and the cycle, or there may have menstrual cycle. The other, during pregnancy, the source of estrogen is the placenta during pregnancy. And during pregnancy, the source is, as we all know, placenta. And estrogen can be produced from placenta in gravid or in pregnant women. Let's see the final hormone in the female reproductive system and function of it. As we have seen, it is produced by corpus luteum after ovulation in the ovary, and its function is preparation of the endometrium or the lining of the endometrium, which means for the after ovulation and in between ovulation and the menstruation, there are around 14 days, or the first half. In the first half of the menstruation, the work of progesterone is preparing endometrium. Preparing for what? For conception or reception and development of fertilization ovum. If fertilization occurs, or if a woman have sexual intercourse in the next days, the fertilization may occur and the conception or the occurrence of pregnancy may happen. So in this time, the work of progesterone is preparing endometrium for the coming conception or the embedding of or the development of the fetus within the uterus. The other, it also suppresses the production of estrogen after ovulation as occurred. So the presence of estrogen or progesterone in the blood stream or in the circulation suppresses the production of estrogen. So if the progesterone is potent or the progesterone amount is high in the circulation, it prepares well endometrium for the next 14 days during the menstrual or during the first half of the cycle. So yellow body, as we have seen its name indicated, the ovarian follicle, or the after ovulation occurs, the enlarged ovarian follicle release after ovulation, or the empty body, which is the corpus luteum. From where does the progesterone produce? In non-pregnant women, from corpus luteum after ovulation. So please, before proceed to the next session, please subscribe to my channel. Thank you for your subscription and staying with me. Let's proceed to the next title. So let's see the summary of the reproductive system. So here are the hypothalamus at the first level in the brain. So from hypothalamus produces gonadotropin releasing hormone, and it acts upon pituitary gland, and the presence of gonadotropin hormone or the acting upon pituitary gonadotropin releasing hormone on pituitary gland, the two hormones were produced. These were the follicle stimulating hormone and the luteinizing hormone. So due to presence of these two hormones in the circulation, or if these two hormones act upon the ovaries, there are two hormones will be produced, two female sex hormones, which are estrogen and progesterone. So here are two anatomical positions, the pelvic cavity and the brain. So there must have coordination, and there must have the anatomical structures normality in to function normally. So in summary, for the reproduction of the human reproductive system, or for reproduction purpose, an individual must fulfill these all steps or chronological orders. Because if an individual have no functioning brain or something wrong, or this, if the pathological condition occur in the brain, which means at the hypothalamus, the gonadotropin releasing hormone will not function normally, and it will not act upon the pituitary gland. So there is no enough amount of follicle stimulating hormone and luteinizing hormone. So if there are no follicle stimulating hormone and luteinizing hormone, there is no production of estrogen and progesterone. Let's see the rest session objective, or the second title of this session, which is about the menstrual cycle. So we will see detail in next sessions about menstrual cycle. So the main issue in our mind must be that why menstruation occurs. From where does this bleeding come through? So it's periodic. It's periodic. Whatever it's regular or irregular, it's periodic uterine bleeding. Due to what? Due to cyclic hormonal changes. Throughout the life of the woman reproductive age, there are so many cycles occur. So those cycles occur or act on the ovary, the uterus, and the cervix due to or in response to hormonal changes. And the duration or the onset at which age does the woman or an individual can see the first menstrual period or age at menarche is vary. There is great variation, as we can see from this slide. It shows us one individual can see first menstrual period at the age of 19, or the other may see at the age of 70. There are a great variation. This is obviously practically is reality. So there is an age variation between an individuals for the first menstrual period. So what's the advantage or the purpose of menstrual cycle? To bring an ovum to maturity. Because if there is no cyclic change monthly, there is no hormonal variation or hormonal production. As we have seen, the 5 hormones as an introduction, we have seen many hormones can circulate in our body in each month cycle. The second purpose is uterine tissue beds that will be responsive to the growth of fertilized ovum can renew. How it can renew? As we have seen previously, the purpose of progesterone after ovulation is preparing endometrium for the development of the fetus, or for the acceptance, or for the comfort. It makes comfortable endometrium part, comforting endometrium. At this time, if fertilization occurs and a woman is able to conceive, the comforted or the prepared endometrium can receive the fertilized ovum, and the fetal development will proceed. Unless, if there is no fertilization occur, it sheds out as a menstrual period, including the shedding of the endometrium, which renews uterine tissue bed. It's renewal. And in the next periods, this cyclic change will continue in our reproductive life. The average duration, the average length, the average flow amount, everything of menstrual cycle differs from individual to individual. There are many factors which can affect the average onset of menstruation, its time, duration, the length, depends upon the many factors of an individual. For example, if a woman has other underlying factor, like if she use family planning methods, any contraceptive method, she may not see menstruation, or the duration may delay. So the average menstrual flow, the length may be from 1 to 9, and average length maybe 5 days, and the amount average flow maybe 80 ml of blood amount. Some women have symptoms of anxiety, fatigue, abdominal bloating, headache, appetite disturbance, irritability, or depression in premenstrual period. This is obvious. It's practical. Some women may not complain the menstrual period. It depends upon there may have individual difference. Some women may experience abdominal pain. This is all due to the presence of hormonal changes in during the time of menstruation. Like, for example, if the woman complains abdominal pain, there is a release of prostaglandin. Either during time of ovulation, there is production of prostaglandin. Due to production of prostaglandin, she may feel abdominal cramp or pain, and irritation or drop or follicular fluid or blood spills into abdominal cavity. As this time may experience abdominal pain during menstruation. So let's see phases of menstrual period. The average of knowing menstrual cycle is when to conceive, or is the advantage of knowing menstrual cycle, or the advantage of knowing when she can conceive or not, which means we have to count the days, or a woman in which period a woman can be fertile, or which period is going to be fertile for him. In here, by only menstrual phases, knowing phases, or menstrual cycle knowing is doesn't work for all women. For example, if a woman have irregular menstrual cycle, it's difficult to determine or to understand when to conceive. So in some women, it may work. So let's see the phases of menstrual cycle. The menstrual phase, which means from day 1 to 5, if there is no fertilization occur, the corpus luteum will degenerate, which means if there is no corpus luteum, there is no production of progesterone, and there is no progesterone hormone or decreased amount of progesterone hormone in the circulation. So at this time, the thickness or the endometrial thickness will disappear, because thickening the endometrium is the work of which hormone? Progesterone hormone. The rest, so if there is no progesterone, there is shedding of endometrial lining. So the muscular wall of the uterus contract at this time, and blood supply to the endometrium will occur, so causing the break away from the uterus. There is break of the endometrium blood supply and the tissue. So the mixture of tissue and blade passes out through the vagina, and this we call it the menstrual fluid or the menstrual blade. The second one is the proliferative phase, which includes from day 6 to day 14. So the concentration of estrogen in the blade is rising during this period because there is decreased amount of progesterone. So following the end of menstruation, as the ovaries prepare for the next ovulation at around day 14. So after ovulation, the menstruation may happen, either menstruation or conception may happen. Following menstruation, there is follicular preparation, or the ovaries preparation for the next ovulation. So we call it proliferative because multiplying of or increase of the follicles at this time. So in this period, the endometrium thick and become more richly fed by blood vessels for the possibility of pregnancy or fertilization. The second or the third phase is day 15 up to day 28, which is the secretory phase. During this phase, the blood concentration of progesterone increases, which causes more blood vessels can grow in the endometrium. So endometrium may be receptive for fertilized ovum. So the ovum fertilized the embryo implant, unless we can, if there is the fertilization cannot occur, again the rest cycle of menstruation will occur. Shedding of the endometrium will occur. And in this case, or in the case of secretory phase, there is hormonal production. Which hormone? The progesterone from corpus luteum can be produced. So it continues its work till the next either menstruation or implantation. So it produces a hormone called HCG, or human chorionic gonadotropin hormone, throughout pregnancy. If pregnancy occurs, HCG will produce. Let's see summary part of this session. Before we go to summary, please subscribe to my channel and like this video. We have seen the hormonal regulation of female reproductive system. We had here objectives or learning outcomes. What are the hormones, or the 5 main hormones in the reproductive system? The gonadotropin releasing hormone. The second one is the follicle stimulating hormone. And the third type of hormone is luteinizing hormone. And the rest, due to presence of luteinizing hormone, there is estrogen and progesterone production from ovary. We have seen this, and the summary looks like this. The brain and pelvic cavity must function, and the rest, the next topic covered by this is about menstrual period or cycle, the purpose of knowing menstrual time, and the experience of the woman during menstruation. We have seen the phases of menstrual cycle, around 3 phases: the menstrual phase from day 1 up to 5, the proliferative 6 up to 14, and in each phase what the hormone or what occurs, and the last one is the secretory phase. Thank you for watching and spending your time with me. Till the next, stay safe. Bye. Have a nice time.